Hi, this is Dr. Carl Hansen with Infinity Health Direct Primary Care. Today another lesson in some of the vagaries of health insurance, and specifically this is about individuals who have high deductible health plans. A lot of individuals may have health care coverage from their employer, and a lot of times the employees are shocked to find out when the new offerings come due at the time of the new year that the deductible is much greater. The premium might be a little bit more per paycheck, but the thing that impacts people the most from a standpoint is going to be the aspect about the deductible. Now, a higher deductible is nothing to be upset over. It's not as much of a benefit. Obviously, if you have a $500 deductible, then you only have to pay $500 in costs. If you have a $6,000 deductible, then you're responsible up to that amount before your insurance kicks in, either in whole or in part. But that's not really a bad situation. If you think about what insurance is for, insurance is to cover you against bankrupting, catastrophic, high-ticket expenses. It's not to cover everything. It's not to cover the first $1,000 of everything you do. Think about your automobile and homeowners policy. Think about those insurances. They don't cover first dollar stuff. You only make a claim against those if something big, catastrophic happens. Not if you're changing AC filters or changing the oil in your car. So again, we need to rethink really what the practical application of having health insurance is. If your healthcare policy covers everything, then it's not really insurance. Instead, it's a prepaid health plan. And a prepaid health plan, because it covers everything, the premium is going to be much more expensive and often not affordable. And it makes no sense as far as insurance policy. So as an employee, if you find that your deductible is significantly higher, no need to panic. There's one thing about having a high deductible policy is that it allows you to participate in health savings account. Now, what's a high deductible policy? Well, that depends on IRS definitions. And for 2018, if you're an individual, if your deductible is greater than $1,350 per year, then you're classified as having a high deductible healthcare policy. If you're a family and your deductible is $2,700 or more per year, that also calculates as a high deductible healthcare plan. So if you're over those two numbers, this applies to you. So you will be able to contribute to a health savings account, which operates somewhat similar to an individual retirement account. Money that you put in your HSA or that your employer may also put in your HSA, your health savings account, money in there that gains any earning or interest is tax-free. You do not pay taxes on that gain. More importantly, the tax deductibility is a big part of it. If you're able to put $2,000 into a health savings account, for example, but let's say your salary is $50,000, or let's say that's your taxable income, and you have to pay taxes on $50,000. If you put in $2,000 into your HSA, that comes off the $50,000. So actually your taxable income is really going to be $50,000 minus $2,000 or $48,000. So the income taxes you'll be paying will be on a lesser total amount because you have pre-taxed, put some of that money into your health savings account. Now, how much can you put in? If you're an individual and you have the deductible of $1,350 or more, if you're an individual and have a high deductible health plan, you can put up to $3,450 into an HSA every year. All right. If you are a family, again with a deductible of $2,700 per year, if you're a family, you can put up to $6,900 every year into a health savings account. So that's a large sum of money that comes off the tax books and goes into a fund that is actually gaining interest and earnings tax-free. So why put money into a health savings account? Well, if you ever do need to pay for any medical expenses, they can come from this HSA. They can come from this tax beneficial account that you've set up or that your employee has set up. I bring that up simply because as an individual who purchases their own policy on the market. Again, if you're high deductible, if your criteria are met, you get to create your HSA and fully fund it. Benefits of an HSA. The benefits are it can pay for any qualified medical expense. Now, that is defined by IRS regulations. Please look up IRS publication 502 for what a qualified medical expense is. Additionally, if you want to look at more details about what an HSA is about, you will look for IRS publication 969. Go to irs.gov and do the search for publications 502 and 969 respectively. An HSA, as you get older, past a certain age, you then may start taking money out for non-healthcare related expenses, much as if you would do an IRA. However, up to that age, if you take money out of your HSA to pay for other stuff, like car tires, there's a penalty that can be imposed. Again, HSA is a very attractive savings account and growth account, but you can only have it and pull from it for medical related expenses. The other aspect of an HSA is that this fund, this account, is portable. It goes with you. If you change jobs, if you change policies, this is yours. This does not belong to the company. Another beneficial part about HSAs is that you have the investment opportunities that you like to exercise within it. Now, you're not eligible for an HSA if you can be claimed as a dependent on somebody else's income tax, or if you have Medicare, or if you have another form of health insurance. By regulations, you cannot be eligible to contribute to an HSA in that instance. However, the HSA does grow tax-free, and again, it's a taxable pre-tax deduction issue. And look up these publications for more details. You do not need to get an accountant or a tax attorney to walk you through this. This is very simple. So when you get confronted with this HSA issue and a high deductible health plan, don't panic. This is actually, in some instances, a good thing. It allows you, as a high deductible health care plan owner, to gain access to this very, very favorable HSA type of market. So if you are in that situation, I really urge you to look into your HSA, to fully fund it. If you fully fund it this year, you can fully fund it again next year. There is no maximum that you're going to go up to. So this can continue to be fully funded. How much do you fund it? Well, if you have a $10,000 deductible healthcare plan, maybe you want to, over the course of a few years, fund this up to greater than $10,000. So if there is a catastrophic expense, you have a tax preferred account that is now able to pay off these expenses that you have piggy banked away. So, very favorable. There is some legislation out there that has passed the House. It's called, the bill is HR 6199. It passed the House in 2018 with really great bipartisan support. It's called Restoring Access to Medication and Modernizing Health Savings Accounts Act of 2018. And what it does some beneficial things also with the HSA that we can cover at a later time. So, high deductible health plan, that's good. It should be cheaper, especially if you're on the open market buying your own. It does allow you the wonderful opportunity to participate in HSA. Please look that up. At the end of this video, I will have the links to the pertinent publications. If you like us, thumb up, and also don't forget to subscribe. And we will catch you later, and I hope to do a video on HSA as it relates to direct primary care in the very near future. Thank you all.